Welcome back. Unfortunately, we won't be bringing you the news, but continuing with our conversation regarding the rising cost of medicines and healthcare in Nigeria. As many people should be concerned, including us here inside of the studio, I've only just learned that one of us here has just mentioned how many numbers of mouths he has to feed and also take care of when it comes to their health. Lekan, you're welcome again. What a shock it was, but then again, you are a sample of most Nigerians who have to take care of not just themselves, but their families, and with the rising cost of medicines, especially if you're like I and Judith, who have aging parents that you must take care of. I mean, you've experienced what's going on.
And both of them have underlying issues, which is just not
that makes it
fun.
Very...
And the price of drugs that's between... Last year around this time and this time, tell me why inhalers... Okay, I'm going to stop now.
It's personal, it's very personal. But tell us, she asked from earlier what you discovered while you were gathering this report.
Okay, so let me start from here. Nigerians sleep and wake every day hoping not to fall sick. Yeah. Because the moment you're sick, the next thing that comes to your mind is not even how to get healed. It is, how much do I pay to get it? Because number one, you're going to the hospital to see the doctor, you're paying. You're getting prescription drugs, you're paying. You're going to be getting syringe, you're paying. You're going to be admitted, you're paying. You're paying for everything. If you decide to go to the pharmacy, you are paying. So some people now feel like, okay, what do I do? Do I go to the pharmacy? Do I go to the hospital? Or should I just self-medicate? Or even go to, vendors, herbal vendors, to just get something I can just take and make me feel fine. So that is where, Nigerians are now. It's a dilemma. Do I live? Do I die? How much do I spend? Then you're thinking about yourself and you're thinking about your families too. You are literally praying every day that I don't want any member of my family to fall sick, because the bill comes to your head and nobody plans to be sick. It's unprecedented, and that is the most important part of life right now for Nigerians. Now let me now come to the other part. For drug manufacturers and for hospitals, that usually import equipment for medical treatments, they are actually going through pain right now because they have to pay so much to import, materials, raw materials to produce drugs or medical equipment to treat people. And they know that, by the time you import all these materials, you are paying import duties, you're paying taxes, you're paying the cost of transportation, the cost of production itself, has gone, over the roof. So by the time you put all that together and you put that bill on the consumer, will they be able to pay? So that is the pain. So medical practitioners are trying to stay afloat. They're trying to stay in business and still provide health. And they're equally scared. How do I stay in business when I have to put all the cost of these things on my business in provision of health, knowing fully well that people might not be able to afford the payments? So it's a big issue now for everyone on the part of those who are providing health, on the part of the consumers that are equally receiving health. And everybody is wondering, how do we survive?
How did we
put it in a very mortal way when you say, do I live or do I die? That's very...
But you know that we're one sickness away from poverty.
Wow, you're depressing me now.
But it's true. Like it's one sickness away for you to start crowdfunding and having a GoFundMe on Twitter and having your friends and family send links to people to crowdfund for you to get better. It's just one thing that can bring us down to poverty. And so, I've just painted a dire, critical situation, but Dr. Owen, you're right in it. You're right in the storm. You're seeing it. When it comes to access to affordable medicine, what is it? What exactly are the issues? Why are we seeing this?
Okay, so earlier you mentioned, by the way, Lekan, that was a fantastic piece that you put together.
Thank you.
Well done on that. So you mentioned three critical things. So accessibility, affordability, availability. But I also want to add quality as well, right, to that list. So what are the issues? These are the four cardinal things that we should be looking at. When you talk about quality, of course, that's where we talk about NAFDAC. So yes, we import 70% of the medications that we consume here are imported. And even for the ones that we manufacture locally, 50% of the raw materials are imported, right? So quality, on the aspect of quality, NAFDAC, I think they're doing a good job with that. I know that there's still a lot to be done with regards to locally manufactured products and ensuring, that they have the right licenses and things like that. So that's the issue with quality. Then affordability. So we had JSK, we had Sanofi leave Nigeria. Yeah. So we had them leave Nigeria recently, right? And those are some of the major manufacturers and distributors of essential medications in Nigeria. And when you have that situation, obviously prices are going to go up because now they've shifted to a third-party distribution model, which obviously makes it, harder. Why did they leave? What are the issues? I say if you want to do business in Nigeria, you have to have like 9 lives, right? You have to turn into a cat. Because, you will fall more times than you would probably be able to get up, right? So we have a very harsh business environment here. And so they were making losses and they had to leave. So that has driven up the cost. Of course, FX, like I said, most of the medications are imported, and even the ones that are manufactured here, over 50% of the raw materials are imported. So you need access to FX. Now you have, the dollar rate doing the yo-yo and, dancing galala up and down. So that's a major issue. Of course, you talked about taxes in your piece, Lekan. That's also another issue, multiple taxation, custom duties and things like that. And I think what the government has done, recently there was an executive order to cut out import duties and to take out VAT on essential raw materials to boost local production, right? So that in itself is a good policy, but in terms of the implementation, so this is supposed to run for 2 years, right? In terms of implementation, you still have people who, the time that it takes to import these things, you have things on the sea. Is it the 2-year period? Is it actually going to be sufficient? And if it's not properly implemented, then, that in itself could fail. Then in terms of accessibility, that's a major concern because you'd be surprised that the people who live in the rural areas, who are the most vulnerable, right? They pay more for these medications. Because in terms of supply chain, getting it to the rural communities is harder. So you find that the more privileged in society actually buy these medications cheaper. And so we need to be innovative in our supply chain management to ensure that what's getting to the people, they're not having to pay an arm and a leg for it. Improve supply chain through PPP.
Private partnerships.
Yeah. But Dr. Owen, as a practitioner yourself, noting that Nigerians have alternatives for anything. Fuel scarcity, I used to drive a car, I'll drive a bike now. We have solutions, alternatives. What alternatives do consumers have or people who are seeking this, Nigerians generally have when it comes to healthcare? If I can't afford these medicines, have you seen in any situation where perhaps herbal alternatives are advisable? Would you advise that should be a thing that Nigerians carry on with now, even in terms of academics, research, making it a bigger...
So in this case, one of the negative effects is poor seeking health habits. So people now tend to, resort to Holy Spirit for healing, for divine healing, right? So that's what we get to see. You see people skipping their medications, right? Just to make it last longer, right? And then we go to alternative medications. Alternative medications, herbal medicine in itself is not a bad thing, right? It's not a bad thing. The problem is that we have not invested enough in research to know, the type of herbs, the composition, the dosages, safety, efficacy, things like that. So we've not invested so much in research. Chinese herbal alternative medicines work fantastically, and that's because they have invested largely in research.
Is this the time then? Should Nigeria begin to do that?
Absolutely. This is the time there isn't a better time. So we need more budgetary allocations and we need political will. We need people who actually have the vision and foresight to understand that we need to get out of this hole. We cannot continue. Nigeria we're too import dependent and we're so blessed. And it's funny, right? I mean, growing up, we used to shout out to Dr. E, my mom, she's a nurse, but she used to give us herbal, medications, and which worked. Those things actually work. But then again, you need research because you need to know what's the dosage,
the severity,
so you don't
how best to
overdose. Yes,
dose it,
exactly.
and then
What do you mix together? What concoction? Do you understand? So we can't continue with this hit or miss approach to herbal medications.
Let me come to you, Lekan, and ask. I remember when Doctor here was talking about the import duty and VAT removal for essential ingredients or products to boost local manufacturing. You were shaking your head, right? When I was watching you, you're shaking your head to that part. So I wanted to get your reaction. When it comes to a lasting solution in terms of this problem, do you think PPP and the reversal on import duty and VAT or removal is the right solution?
Okay, so let me start with the issue around the VAT and the import duties being removed. Fantastic, like she said, it's good. But then when you look at the possibility, the implementation, and what impact it would have overboard or over time, you discover that it is minimal. All right. So when I spoke with some of the pharmacos, the pharmacists, those who manufacture drugs, they said it is nice, but it's more or less like a drop in the ocean. Why? Because she mentioned it. Forex is the issue. If I'm going to be importing, and the dollar rate is now 1,600 compared to 6 months ago, compared to a year ago, you discover that, that lacuna, filling that gap financially is a huge burden on the manufacturers. So that is the issue. So they are saying that, okay, if there is going to be a need for us to upscale our operations and to stay in business, and you cannot remove fuel subsidy because it's part of the issue, let's ensure that Forex is stable. And let's ensure that the dollar is available so that when we're able to access Forex and the Naira to the dollar parity, is pegged and it is stable, then we know how much we need to spend. So if it is just 2,000, if it's 3,000 to $1, we know that this is the amount. And that sustainability will help them project and plan and say, okay, this is the amount I need to spend to import.
So the FAMCOs are still looking up to the government for solutions?
Basically.
But this is the same government with people in it who have access to, jets that they can fly outside of the country.
Can go and walk
and go get medical tourism.
That's normal. It depends on priority of
Doctor,
government.
I don't know. Is the government the right people to turn to? I mean, you already suggested research into herbal medicines and alternatives, thank you very much. But is the government really going to help in this case, or should we just find our own square root?
The truth is, of course, there are multiple stakeholders. So the government, financial institutions, international organizations and donor bodies, these are all multiple stakeholders. So we need to be creating, so yes, we need FX, right? But another problem, and just being an entrepreneur and, being in the field of distributing and selling medical equipment, consumables, and medications as well, because that's part of what my company does. I know that one of the major challenges is access to capital, access to funding. So we need to encourage the people who are currently playing in that space and other new players coming in. And that's where the financial institutions come in. The rates, the interest rates when you're getting funding or lending from the commercial banks, it's crazy. The interest rates are crazy. And so where government can come in here is to say, so we have Bank of Industry, right? It shouldn't cost an arm and a leg for you to get funding and support from the Bank of Industry, right? corruption is a major challenge, right? So when you're going to the government and government institutions that provide lending to manufacturers and things like that, there's a lot of corruption in that system. I mean, we would probably need an entire week to discuss that.
Yeah, we can come next
right?
Saturday.
You know, and then of course I talked about international donor organizations. So grants, single-digit interest loans, you know, things like that. Those are things that could encourage local manufacturing, because I think we need to start moving from our over-dependency on imports to encouraging local manufacturers. And then, of course, there are other things that we can do apart from the local manufacturing as well. I think that government can subsidize. So now with the subsidy is gone, but subsidy don't come back, right? But I'd say, like, why don't we subsidize things like essential medications? Because you go to our public hospitals and they're out of medications, right? So why don't we subsidize essential medications in public institutions, public hospitals, strengthen primary health care, so that people can have access to, these essential medications, and of course, CSR, ISR, so individual social responsibility, corporate social responsibility programs, sort of like what my distinguished senator is doing, Senator Neda Imaswen.
I've started. It's okay. Yeah, you cannot campaign here.
No, I'm not campaigning.
I'm
It's not
joking.
campaign
I'm joking.
season.
Back to regular programming.
Because we're pressed for time.
Okay.
CSOs, collaboration, government, individuals, international bodies. Is there more that we can do to bring a lasting solution?
So,
Final remarks.
So yes, there's a lot we can do, and one thing is to ensure that the environment, is conducive for
Ease of
all
doing
parties, for everyone. So even if we are going to be having, people come up, provide loans, grants, and all that, they will look at the environment. If monies are coming in, where are they going to? If investors want to also put their money into, that sector of the economy, they are wondering, will they be able to recoup? That instability itself, will pull them back. And if, like we said, or like I said, if the environment is not conducive enough, if there are no level playing fields, when everyone can come to the party and collaborate to get the job done, then we are just, talking.
You cannot be talking from both sides of your mouth.
Yeah, we are just talking. So those are the things.
You
So when it comes to health, like she said, it's all about finance, collaboration, but then, it's all about the government making it possible for those things to happen. And that is because, like I said, it's not everybody that has access to insurance, health insurance.
That's another
Some
thing.
people have to
Why
pay.
did you mention that word now? We're
I
rounding
just
up.
need to bring it up.
Okay, you work here, you know how these things work. We have to let's round up
So that's
the
just
segment.
it.
But that's a topic, Doctor, that we must touch on the next time that you
Absolutely.
come.
We
Yes.
were talking about it, health insurance, access to health insurance, and how that can help, reduce out-of-pocket spending for purchasing of medications. But I guess we'll find time to talk about this.
As we're talking about that's HMO, which is health insurance.
Health
I think we should also talk about, how it's accessible to people with underlying
Absolutely.
issues.
Yeah.
That is such a big problem because really those are the ones that need
Yeah.
HMO. They need it. They really do.
Yes.
Well,
Dr.
we wish
Owen?
we could exhaust it currently, but we cannot. But then we will be inviting the doctor back again, and maybe Lekan might put together another report regarding insurance, and we'll be glad to have it here on Breakfast Extra.